but I don't think I've been back since. Probably because I had so much time getting in trouble when I was here. Very nice to have the person who this library is named for with us today, Rosemary Hartney, who remembers me from those days. I shaped up a little bit. Finally, it's about time. I'll give you a little bit of my background. As I said, went to this school. I grew up on a farm about halfway between here and Gravelberg, and then we came into the city just before I started high school. And then I went on to university. And somewhere along the line, I'd like to say it all was from Banya, and I'm sure there were some seeds planted, but somewhere along the line I got more exposed yet to social justice. I'm more interested in working in particular in health and medicine in specific, and working with underserved populations. When I first had that vision that I wanted to go into medicine, I applied to the College of Medicine, and they said, I want to go and work with countries in the developing world. Yeah, that's it. We could go to slide 2 by the time if you can get it to the full slideshow. We can spend a little time around the fire since we're here to set one. I went into the College of Medicine. I said, I want to go and work in the developing world. I want to work in Africa or South America with patients who really need it. And they said, well, that's a very nice idea. Where have you been? What have you done? And I hadn't really had a chance to travel anywhere. So they gave me a nice pat on the head and said, go learn something and come back when you know something. Best thing anyone ever did for me. Among the best things was the kindness of the Saskatoon Diocesan Mission that accepted me to come and spend some time with them in Brazil. And while I was there, I learned Portuguese, I learned Spanish, and I learned a great deal about how to be in community in a positive way, how to work with people, not for them. And the work of that mission has really informed so much of what I've done since. Not long after that, I got a chance to participate in another project where I drove a school bus full of prosthetic limbs down to Nicaragua for landmine victims in that country. I later took medications to the same place, so my dad likes to accuse me of having smuggled both drugs and arms to Nicaragua. And after that, finally was allowed into medical school and continued this pursuit of working with underserved populations. That has taken me to where I work today, which is inner city Saskatoon. I work with a largely First Nations and Métis population living in inner city poverty. So we deal with lots of marginalized. I've also had a chance to work in northern Saskatchewan. I haven't made it to Pelican yet, but I've worked in Lacrosse, Pine Housing, a few different places in the north, and all over rural Saskatchewan. As well as here you see me sitting in Mozambique. I go now nearly every year back to Mozambique to work in a rural hospital there. Go to the next slide. And when I do this, I am doing it as a family physician. I go to work with people, and my major goal is to improve their health and their health outcomes. When you see this list, you might see a list of things that you recognize, that you might have heard from your own doctor or from health promotion messages, things you can recognize. Don't smoke, eat well, exercise right, manage your stress, take it easy on the alcohol, practice safe sex, get screened for different illnesses, and know how to take care of yourself in an emergency. These are the common things here about how to keep healthy. And it's good advice, and it talks very clearly about the agency that we have in our own lives. But if we look at the next slide, and this has been lost a bit in translation, but this is the list of factors that have the biggest impact on whether or not you'll be healthy or well, whether you'll have a life that is long or short. And if you see, the things that were on the slide before don't actually show up here in a meaningful way. Because this is what makes the biggest difference. It's how much money you make, it's how far you were able to go at school, what kind of work you have, your early childhood exposures, whether you can access healthy, nutritious food, whether you have a safe place to stay. Health services, what I and other people in the healthcare field do, that's way down the list of what makes a real difference in whether you're healthy or not. So next slide, please. Looking back to that list of 10, if we're really going to tell people how to stay healthy, this is the list of advice. Don't be poor. Don't have poor parents. Have a car. Don't work in a lousy job or live in crappy housing. Be able to go on a holiday. Keep your job. Take up your benefits. Don't live somewhere where the environment around you is dirty. And learn how to, just in case, fill in your social assistance forms. Now this is all tongue-in-cheek, of course, but it's just recognizing that what we often hear in terms of health messages, well, it's useful stuff, but it's actually a fairly minor factor in what's really making a difference in whether people will be healthy or not. So another way to think about this is those are the political and social factors that make the biggest difference in our health and the quality of our lives. Rudolf Virchow was a pathologist and politician in the late 1800s, very famous for some of the things he discovered in medicine. This is a quote that certainly informed, well, my forays into politics. I see my former vicious opponent, Deb Higgins, when we both ran for leadership of the NDP a few years ago. So I've spent some time in politics myself, and this was one of the quotes that inspired me to do so. But also, it makes me think about politics different. What if, when we were seeing what governments were doing, when we were seeing what politicians were talking about, it looked like medicine? Or what if it looked like their purpose was to improve the quality of the lives of the people of the province or the country? Next slide, please. It would look something like this idea, health in all policies. This is a movement that started in Nordic countries. We've seen it now implemented in Quebec. We're seeing it pop up in municipalities across Canada. It's this notion that every decision, we've got a municipal leader, here's a thought to leave with you, we've got a member of the Legislative Assembly. How can we review all of our decisions through the lens of whether it's in finance, whether it's in education, how are our decisions going to improve our lives? How are they going to improve the health of the population or worsen it? And only make those decisions that are actually going to improve the quality of our lives. It seems like a pretty obvious idea, right? It seems like it makes so much sense that you'd almost expect that that's what's already happening. But if you look at the next slide, what you'll see is a comparison of two numbers. One is a number you're probably familiar with, GDP. So that's the economic growth in gross of, in this case, Canada as a whole. And you see over the last 20-some years, massive growth, a nearly 30% increase in our economic activity. This bottom line is something called the Canadian Index of Well-Being. The Canadian Index of Well-Being is a basket of measures, health outcomes, educational attainment, justice, democratic engagement, the health and cleanliness of our environment. This is a measure of the quality of our lives. And what we're seeing is a great difference between how much the economy has grown and how much regular people's lives have actually improved. Something is wrong in the system because we're not translating that economic success into better lives. If this is medicine on a larger scale, it's malpractice. We're doing it wrong. Why are we doing it wrong? Part of it is the fringe. Sorry, stick back there for a second. When we look here, we're seeing the results of a frame that says economics is everything. And Canadian Index of Well-Being, those other measures of our quality of life, that's an externality, it's an extra. Economics is extremely important. If you think back to that list of what makes the biggest impact, income's the number one. How much money you're able to have as a family, as an individual, has a huge impact on your health. But it's a tool for something else. And we've confused the tool with the goal in and of itself. And that's because of the political frame we're stuck in. We often see people get caught up in discussions around political decisions, get trapped in this frame, fighting about the plan to reach the best economic progress without asking the question, is that really making our lives any better? So we need a new frame. We need a new goal to be clearly articulated and focused upon. And what I've been proposing, excuse me, in my work with Upstream, in my political campaigns, in A Healthy Society, a book I put out a couple of years ago, is this idea of using health, human health, really, which serves as the canary in the coal mine of the health of our wider society, using it as an explicit goal for what we're trying to achieve through public decisions. And I think that's a good goal for a number of reasons. One, it's something we all care about. We talk about it all the time. Our language is full of references like healthy debate, healthy appetites, we'll toast to each other's health. And that's reflected in people's preoccupations publicly. Always at or near the top of the polls is health care. And health care, while that's not health itself, it's a good surrogate for how important health outcomes are in our lives. So it's a destination that's meaningful and matters to us, and also that we can measure. We can tell whether or not we're actually reaching it. We measure in great detail the outcomes of different illnesses. We're at the point now with the science of epidemiology that we can predict with a fair amount of certainty the impact of a policy change right down to the level of a neighborhood or even an individual. So we've got a destination that we can measure whether we've got there, and we've got a roadmap. That list of the social determinants of health is also the stuff of politics. You can map each one of those onto, that might be my next slide. Yeah, you can map each one of those onto a ministry or a department within government that has an opportunity to have a significant impact to improve our health by addressing the way in which these different policy areas are managed. Next slide, please. Now this is not a brand new idea. Social determinants of health is a concept that we've known in some way for centuries and centuries. Since the 1970s, there have been clear studies that have shown that list of the impact and the order of their impact on health outcomes. But it's a concept that has stayed kind of stuck in academics, in people who think about policy, that hasn't made the leap into everyday conversation, into what politicians are hearing on the doorstep in terms of the demands that they need to have addressed. But I see some hope. I see some change in that. One of the signs of change is a movement among physicians. We hear more and more physicians saying, we learn in medical school that that's what makes the biggest difference, and then they tell us what drugs to prescribe. There's a disconnect between health and the actual work that we do. So you've got physicians like this Dr. Manchanda in the States. This is a book called Upstream Doctors, who is working with physicians across the country on how to ask more questions about the determinants of health in the lives of their patients and try and be involved in addressing those. So not just prescribing medications, but trying to figure out how they can prescribe, as one Toronto physician calls it, prescribing money. So figuring out how to help people do forms, get access to more income, how to work with local communities on housing co-ops and food security programs. And this is a growing movement across the country to the point that the Canadian Medical Association, which in many of your minds you might not associate with sort of radical social justice. They've often tended to be advocating for more private care or just greater money for their members. There's been a big movement over the last 5-6 years to focus on determinants of health and to demand more investment in the factors that make the possibility of health rather than just dealing with the after-the-fact effects that medicine usually does. Next slide, please. So, go back one slide, that blank one is supposed to be there. If you fiddle around with the mouse, you should see a play button right in the bottom. There you go. So I'm going to show you a little video that talks about how do we go. So we talked about physicians who are now addressing this at the clinical level and community level. How do we go up even further so that we start to see the levels of government and decision making that have the biggest impact actually taking this lens into account and making real change on the determinants of health. So please, play. We have sound. All right, you're standing by the edge of the river. Is it going to go that slow though? Oh no. Technical difficulties. Well, this is a nice story that's told in the voice of a very charming young woman named Rachel who works with me, but I'll tell the story instead. So it won't be nearly as nice as the animation. But imagine you're standing by the edge of the river. You see a kid floating by, starting to drown. You're a brave soul. You haul off your shoes and take off your jacket and you dive in and you pull that kid to shore. You've saved a life. It's wonderful. But then along comes kid number 2. You can just stop the video, please, because I think that's going to be too strange. Along comes kid number 2, and you got to dive in and save another kid. Okay, good. And then comes kid 3 and 4 and 5, and you're having to call everybody you know, come on, down to the river. You got to help me haul these kids out. Kid after kid trying to drown. So eventually, hopefully, someone will scratch their head and say, who keeps chucking these kids in the river? And they'll head upstream, and they'll try and find out. Upstream is this concept. That's a story that I think illustrates really well how we spend most of our time responding to the results of what makes people ill in society rather than actually dealing with the root causes. Go to the next slide, please. Before I had a video, I had a son and had to give a similar talk, so we went out to the South Saskatchewan River and threw him in so I could take a picture. If you look closely, you can see a shadow of his dad. I am under the water. It's me that chucks that kid in the river. I'm sure his therapist will find it a very entertaining story someday. Next slide, please. So Upstream is really a new organization we launched about a year ago, and it's a national movement, a nonpartisan, nonprofit organization focused on trying to shift this concept of determinants of health out of the shadows into the mainstream of political discussions, trying to shift us towards that. Health as a destination and the social determinants of health as the roadmap to get there, make that the frame through which leaders of all parties are needing to speak to the public because that's the demand that's coming forth. So we do that in a few different ways. One, in terms of the structure of the organization, we've got our think tank. We work with academics and advocates from across the country to gather the best evidence on what policy decisions would make the most difference in people's health, in housing, in food security, in income, in employment. Next one, please. And then we tell that story, because we can't just go around hammering people over the head with numbers. If there's no feelings to the facts, we're never going to make the connection that's actually going to make a difference in people's activity. So trying to make that emotional connection to the intellectual background with the intention of really building a national community of individuals and organizations that are using this language, using this frame to approach the different issues that they're needing to deal with. So that over time we have a nimble network that can respond to new issues, but also, I think more importantly, a sustained use of this language, so that over time you start to see different groups, unexpected groups, people in the public and political parties talking about how they're going to affect upstream change for better downstream health results. Next one. One of the things that we have been involved in is a campaign called Poverty Costs. And Poverty Costs, we were able to try out really all of these elements. Next slide, please. One is using our think tag to show that Saskatchewan, being one of 2 provinces without a poverty reduction strategy, and having about 10% of the population living in poverty, we're losing nearly $4 billion a year. About 2/3 of that is lost economic opportunity. The other third is increased costs in health and social services. So crunching the numbers, saying how important it is from an economic point of view to deal with poverty. But we also told the human story. We worked with people living in poverty to tell their story of the impact of that experience on their lives. We also did some fun things. Fortunately, the video's not working. We did a fun thing where we had 2 kids doing a newscast, and they interviewed your counterpart, Bishop Don, in Saskatoon, and the rabbi in Saskatoon, and interviewed a whole lot of people talking about the effects of poverty and getting widespread community support for a poverty reduction strategy. And then the last piece was really being deliberate about saying, we don't want to just create awareness, we want to create action. So we went to the government of Saskatchewan with this message saying, we need a poverty reduction strategy for Saskatchewan. And we don't know the end result of that yet, but the response has been extremely positive. Not just from the public, but even from the government, because they see that this is something that saves money and improves lives. If we have a poverty reduction strategy, which for those of you who don't know what that might mean, is something that's been done across the country. Different provinces have taken different elements to reach that, but it's setting a target for how much you want to reduce poverty in your province, by which time, and then putting that into effect. When they did that in Newfoundland, they were able to reduce the number of people living in poverty by nearly 50% in just 5 years. Massive change, just because of being deliberate about making a difference. So, because I know I've probably already stolen more of my time than I should have, I will wrap up with a final statement. And this is one that maybe I wrestle with more than I need to. But being a physician who works on the front lines, works with people who do need to be seen regularly, there's a great deal of illness in my neighborhood and a need to have good frontline clinical care. But I spend about half my time doing this, talking to different communities, working on different campaigns to try and make a difference in how we think about health, not just practice healthcare. And there's a tension there. And sometimes I feel a little guilty because I have to reshuffle a clinic to go and give a talk to a different group. But I recognize in my patients that, well, I see patients all the time with illnesses like HIV, who come in with bad pneumonias, bad infections, that I know exactly how to treat. We have the right medications, we have the right antibiotics, the right antiretrovirals, and I can't reach them because their lives are too chaotic to think about taking a pill every day, because they're not really sick with their HIV, they're sick with living in poverty, with not having a safe place to stay, with not having access to good food, with having been part of a community that's been marginalized for generations, with having to leave school too soon, very often becoming parents too soon. For me to try and talk to them about their health means I have to talk to them about those other issues. I need to be helping address their housing, their income, etc. And to do that, in our current situation, our current social and political situation is nearly impossible. We need social change to have the space to improve their health. But that social change within the current frames, within our current political discourse, that social change isn't possible. So we need that reframe. It's the upstream thinking required for upstream action, required for better downstream results for my patients and people all over the province and the country. That's why I do this. Final slide. You can certainly find out more about Upstream online. I'll be hanging out afterwards with books for sale and information on Upstream, and happy to spend time answering any questions. Do we have 5 minutes for questions, or should we wrap up?
I say you can take till 5 too.
Oh, okay, so we got a bit of time.
Break and we'll start the next session at 11.
Okay, I didn't want to be stealing from Father Susan.
You got 10 minutes.
Okay, so any questions or comments or objections?
Well, it's very interesting. Now, the problem that I would say, whether it's municipal or whether it's provincial or federal, is long-term planning, which is an absolute necessity to see success in these areas, and the difficulty to move away from making decisions that fit the election cycle. And I mean, we see that more and more. We're heading in that direction, and I don't know whether it's a result or of the world we live in, where information is and everything's now. You know, we want a problem fixed today, not tomorrow, not 4 years from now. So how do we get around that, and how do we meld the two? That long-term planning is the success that we need for many of the problems that we face.
Absolutely. That is is the most common objection I hear, or most common concern that I hear when we talk about an upstream approach. An upstream approach means thinking about things that, making investments that you might not see the results of for 20 years, but you need to prove to people that they need to elect you again in 4 years. So it's a big challenge. How do we actually get around that? I think there's two pieces. It's the sandwich. You need to have a movement from the ground up. You need to have people in the public saying, we actually will reward long-term thinking. We're demanding language from you. We're demanding plans from you that present a long-term vision. And we're demanding how you address the determinants of health. How are you thinking upstream? We also need some leadership. You need people at the top who are willing to take some risks. We need some people who are willing to, when they're running, say, here's my plan, here's my long-term vision. It's not going to be quick, but it's going to make our lives better. And you need some people who, once they're elected, are willing to govern as though they don't want to get reelected. Govern with a long-term vision. The irony of that is it's probably a great way to get reelected. Right? If you do demonstrate that sort of vision and you inspire people, you have an aspirational model, you connect to people in a different way. There is an app, and I think that's one of the reasons that that's such an important question is because it's the question every time, which means it's on everyone's mind. There's an appetite for leadership that is long-range thinking, that is honest, and that is down to earth about things that actually have meaning in our real lives.
I just find it very interesting that what you're talking about, the upstream problems, are things that we talk about in education, and that as teachers we have the same difficulty in the classroom, and that we're faced with something we can't heal in the classroom because the problem is upstream.
And I think that's very true. When we think about the social determinants of health, we're also talking about the social determinants of educational success, even of those personal behaviors that we talked about at the beginning, whether somebody will smoke or drink or exercise. Their social status makes a big difference on whether they'll make those decisions. When we think about economic success, success in the workforce, all of those come back to where did you grow up, what kind of money did you have in your family, what are you able to access in terms of your material needs right now, as well as having a social support and social inclusion. So that's the other nice thing about this concept is we can talk about it at health, and I think health opens a lot of doors because it's a concept, again, that people have a lot of interest in. There's a lot of value in Canadians around health, but it applies to every other sector as well. The same approach will improve outcomes in various different sectors. Mr. Jackman.
Yes, Ryan, the thing that bothered me when you had it up there, the $3.8 billion in poverty in Saskatchewan, how can that cycle be broken? What, for instance, can the provincial government or the federal government or perhaps the municipal government dovetail in to improve that situation? And how does that situation really affect the people in the province? Not just working people like us, but impoverished people.
Yeah. So it affects everyone, and I think that's one of the key messages of this campaign is poverty isn't just somebody else's problem. Their lives matter. Connecting back to your comments, the primacy of the human condition, the lives of those people are why we really need to make this change, because we need to care about people. But we can also see how when other people are suffering, so are we. Our economy suffers, our opportunities to have the things we need for healthy lives suffer, as well as those people who are living in poverty. So making it about everyone is, I think, a really important point. The next piece is, what can you actually do? And that's why we've been pushing for that poverty reduction strategy, and we're hopeful that the Saskatchewan government will take that message and run with it. Because it's not going to go away on its own. A goal without a plan is a wish. Right? And this is something that requires real intentionality across sectors. So a comprehensive reduction strategy, looking at housing, looking at income distribution. We did run the numbers in terms of what can you do about it. If we took the simplest method, just giving everyone more money through a guaranteed annual income, you know how much that would cost to put everyone above the poverty line who's in poverty now? $1 billion. A quarter of what we're losing from having that many people living in poverty. Now, it's a blunt instrument and there are problems with it, but it's a way to show you that if we put some money into this, we can actually save more and improve people's lives at the same time.
I appreciate what you're saying, but I also think by giving people more money isn't necessarily the answer. And I'd be interested in what Newfoundland is doing. I guess one of the examples would be, we've known for years that smoking is bad, it's dangerous, it kills. And yet there's still people that smoke. So there's that education system that you have to try and bring into it as well to make sure that people understand the consequences of what you do. Like you said, giving more money is a good idea, but do they just buy more cigarettes?
Yeah, so what ends up happening, those health promotion messages, that approach of this is good for a Catholic social justice conference, what's often referred to as the holy trinity of health promotion is smoking, diet, and exercise. Those are really important elements in terms of an individual's upstream choices in their lives, right? Making a choice now to have a better health outcome. But when we actually tease that out, you find out that the people who don't eat don't eat well and exercise, who smoke, are the people who live in poverty. And it's not because they buy more smokes, it's because they live in poverty that they reach, that's what they can access, or they reach for things that give them some comfort amidst their despair. So the methods of just educating really don't go very far. You need to start to look at the social circumstances and economic circumstances that people live in. And I agree, just giving money is not the right answer. That's why we keep going back to a comprehensive strategy that talks about strategies for housing, strategies for access to, in my neighborhood, I live in what's called a food desert. There's no grocery stores around that are affordable and good quality. So how do we have access to food that actually puts the choices in people's hands? So it's creating the conditions for good choices is what we need to do when we address the determinants of health.
My name's Jocelyn McLeod, and you might not know this, but we're doing a poverty cost challenge here in Moose Jaw, and so there's a couple leaders in the community right now that do a number of things like eating from a food basket, not using private transportation, and then myself, I'm currently homeless and I'm eating from the food basket and I don't have a car, and I've been doing this only for 2 days, and I'm going until Wednesday. And when you talk about the cigarettes and things like that, I can tell you right now, I had work yesterday and I couldn't even focus. I couldn't concentrate on anything I was doing. And so thinking of kids that are in the education system, they're sitting in school, they can't focus, they hadn't had breakfast, they can't do this, so they're lacking in the education because they didn't have the money to have the food in their home, right? Or they're eating very poor food. I know that I'm starving. And because I've been eating the food out here, and that's all I've had for like a long time. But so that's that spiral effect. You know, if they had the money, then they could have that good breakfast. If they have the good breakfast, then they can focus in school. If they can focus in school, then they have that education, right? They have that education, you know, because they're learning. Then they start to learn about their health. You know, and they learn about their health, then they're not smoking. Like, you know, they're making those positive decisions, and it's kind of that tumbleweed effect of how more and more things keep going in more in a positive direction. So yes, money isn't necessarily just the solid solution, but it goes to show, like, I'm shaking right now, so weak. But it just goes to show how much, like, little things like this can just have such a dramatic effect on you. So, and Ryan is going to be here on Thursday next week to present again for the Poverty Cost Challenge, just to talk about some of the things he's talked about today, but also to meet some of the participants in the challenge. So you're all welcome.
Someone buy Jocelyn a sandwich later.
Yeah.
And yeah, good for you for taking that on, and it's a great way to illustrate how money isn't everything, but having those material needs met is the foundation for making good choices, right? It's that Maslow's hierarchy of needs brought back. think we have one last question, and then Kyle was going to
you're right.
wrap up. So no.
It's not so much a question as just referring to Archbishop Adams. In his address this morning, he spoke about inequality. Now, maybe some of you are familiar with it's an excellent book called The Spirit Level, and it focuses on a lot of countries around the world and different issues that it addresses. And one of the things really is that everyone benefits in society with more equal society. So perhaps you've read that book also, Brian. But,
Yeah, The Spirit Level is a great book. It shows so clearly how when there's great levels within the and the twist on it, that's kind of obvious. You'd sort of expect more poor people are sicker, worse health outcomes overall. But it wasn't just the poor people, it was the wealthy ones as well. If you're at a higher socioeconomic status in a more equal country, your health is going to be better than if you're at the same status in a less equal country. There's something about greater levels of inequality, whether it's just the insecurity, whether it's greater crime, the drain of $3.8 billion a year on the economy that hurts all of our health. And so that's a really important message to bring forward. Upstream thinking has to include thinking about greater equality. Addressing the determinants of health and addressing inequality are basically the same thing. So with that, I'll thank you very much for your time, and I'll be hanging out during the break, and then I'll need to wander off. So please, if you'd like to come say hello, do.
St. Joseph Justice, social justice, I'd like to